Next topic is hematology, reproductive medicine, and OB. All of this is 9% of the exam. So starting with hematology, anticoagulants and their indications. So if you have AFib, meaning your heart's not beating correctly and there's an increased chance of clot development, for prophylactic to prevent clots from forming, you're going to use warfarin or other non-vitamin K anticoagulants. These include rivaroxaban, apixaban, and dabigatran. These all have short half-lives, so you can basically reverse them. For heart attacks, you're going to use Plavix or clopidogrel, which is a platelet aggregation inhibitor. For deep venous thrombi and pulmonary embolism, you're going to use heparin and low molecular weight heparins, which are fondaparinux, dalteparin, and enoxaparin. These function by enhancing antithrombin, and you can, if you find out that they were given mistakenly and the patient needs surgery emergently, you can reverse it with protamine sulfate. Some common coagulation diseases that we see. Hemolytic uremic syndrome is a pediatric thing that happens after food poisoning. The poison goes into the body. It causes a lot of destruction of the platelets. The adult similar equivalent is TTP, and both of them will have lab findings of pallor, so paleness, and then also thrombocytopenia, which is a loss of platelets. TTP is associated with increased Adams TS13 activity. Looking at some specifics about coagulation testing, a Wells score is for DVT. A score of 0 to 1 indicates you need testing only with a D-dimer. And if it's normal, you don't need any further testing. Some anemias. So there's three main classes of anemias. Microcytic anemia is when the blood cells are less than 80 microns in diameter. It's due to low hemoglobin. This can be due to lead poisoning or thalassemia, so a genetic issue that will cause small red blood cells. Normocytic means normal sized red blood cells. If you have normal red blood cells but you still have a low blood count, then that's usually due to a specific disease. So it can be due to lupus, it can be due to cancer, it can be due to Epstein-Barr virus, or it can be due to disseminated intravascular coagulopathy, TTP, or just simple blood loss. The last class is perhaps actually a little bit more common, and I've seen it in clinic a few times, is macrocytic, which is when the red blood cells are actually big. So if they're big, that means they haven't divided enough times, and if they haven't divided enough times, that's due to not having enough to make DNA. Well, what you need to make DNA is B12 or folate. So the first things you'll look for is to check a B12 and a folate. If the B12 is normal, you're going to confirm it with methylmalonic acid testing. If it's normal, then it's going to probably be a folate deficiency. If it's elevated, then it's going to be a B12 deficiency. So if MMA comes back elevated, B12. High is B12. 12 is high number. Sickle cell. Sickle cell is another disease that affects the blood. You're going to give babies who have sickle cell an additional pneumonia shot, so PCV13 vaccination at 2 months old. And remember, only give them inactivated vaccines because they are more vulnerable. So do not give them measles, mumps, rubella. A few kind of random things with regards to infectious things. Let's see. As we talk about now transitioning to reproductive medicine, the most common cause of scrotal kind of testicular infections is gonorrhea, chlamydia. And recognize that for puberty, expect first for men a testicular volume increase, then hair growth, then the growth spurt. The growth spurts last. For girls, you're going to have periods start as ovaries mature, then breast buds, and then growth spurt. girls generally start their process earlier. Talking about some developmental pregnancy testing. So at 24 to 28 weeks, you're going to check everyone for gestational diabetes. You can treat gestational diabetes with metformin and insulin. Other medications are contraindicated. So at that 24 or 28 week test, you're going to give them some sugar. And if they're fasting, their sugar should not be over 92. 1 hour after you've given them the sugar, if it's over 180, that's positive. 2 hours later, if it's over 153, that's positive. Pregnant women can have high blood pressure as well. You cannot treat it with your traditional ACE inhibitors like lisinopril. Instead, use nifedipine or hydralazine. And then if your pregnant mom is depressed, you can use Zoloft. That is safe. Recognize if you're going into delivery and you look at the chart, late decels, so the baby's heart rate is dropping after a contraction, that means there is an issue with getting oxygen to the baby. Now, if we're going to talk about preventing babies, Plan B is useful up to 72 hours after unprotected sex. You have generally 72 hours to stop implantation of an egg. If you've had unprotected sex and it's beyond 3 days, then you're going to use the copper IUD. The first line for menopause, for hot flashes, is paroxetine, Paxil. And then in terms of female health, so if a woman who is under the age of 30 has a lump in her breast, you're going to order an ultrasound. If they're over the age of 30, you're going to get a full mammogram. The reason for that is once you get past 30, your breast tissue becomes more fibrotic and you actually need a full mammogram.